What would Senate Bill 3 mean for women seeking health care coverage for abortion in Pennsylvania? I'm Jill Horner. This is Comcast Newsmakers. With me this hour is Pennsylvania State Representative Babette Josephs. Thanks for being with us.
My pleasure.
Let's first start by talking about what's happened at the federal level, and then we'll move to what's happening in the Commonwealth. Talk to us a little bit about what happened at the federal level with health care reform when it came to abortion coverage.
Well, when health care reform came to abortion coverage, it was not reform, it was regression. What women are required to do, according to the feds, is pay with 2 checks. You can get abortion coverage, according to the feds, but you gotta pay it entirely out of your own money. If you're working and there's an insurance policy that covers everybody, you have to pay separately for abortion coverage.
But hasn't it been at the federal level, and please correct me if I'm wrong, but that abortion coverage was a separate entity anyway in terms of federal funding for that?
Well, for poor women who depend on Medicaid, yes. And so for poor women, the wonderful Supreme Court decision that said if you choose abortion, you're allowed to have one, doesn't count. Now this is going to be extended through state legislation to many, many more women. The fact that abortion is illegal is legal. Let me say that again. Abortion is legal. It's not going to help very many women, and the state, Senate Bill 3, is trying to cut that number of women down to 0.
So let's talk about who this would actually potentially impact for Senate Bill 3. It would be women in certain healthcare pools. Explain to us what that means.
Well, the exchanges. And the exchanges were set up to give relief to small business owners, many of whom are women. People who work for small businesses, many, probably more than half are women. People who are self-employed, probably more than half are women, and people who are unemployed, and probably more than half of them are women. There are some exceptions, but the exceptions are so small, they do not count. None of these people, business owners, business workers, and small businesses, self-employed or unemployed women, would be able to get abortion coverage, period.
Now, at the federal level, you would be able to have that separate option. Would that be different than at the state level?
I guess you could go out and purchase an abortion at the state level with your own money, but you would not be able to get coverage through the exchanges, which are somewhat subsidized, period, in Pennsylvania. So if you are a woman who has already insurance coverage, and you're a small business owner or worker, or you're self-employed or you're unemployed, health care reform in Pennsylvania is a step backwards.
And where does this Senate bill stand? I know you're in the House, but where does the Senate bill stand?
It passed the Senate Banking and Insurance Committee. It goes to the full floor. And if you are a woman or a man who cares about comprehensive gynecological care for women, which is absolutely important, essential for women's good health, you make sure your senator hears that you want abortion covered.
And I want to quickly talk about the potential timeline for this, because there's the federal plan, and those ideas will be implemented incrementally by 2014. Plans will be in place. Does this change this plan at all?
No, we're talking about 2014 as I understand it, but the timeline for this bill is that the opponents of legal abortion, the people who want us all in the back alleys again, are going to push this as fast as they can through the Pennsylvania legislature. So do not hesitate.
Thank you.
Let them know.
Thanks so much. We've been talking with Pennsylvania State Representative Babette Josephs. I'm Jill Horner.